This is the Coronavirus Morning Report for Thursday, April 16th, 2020. I'm Jackson Bird. Singapore has its worst coronavirus day yet. More worries about meat processing facilities in the U.S. New antibody tests announced. More on what recovering from COVID-19 is actually like and why overdoing exercise might actually lower your immune system. Worldwide confirmed cases have topped 2 million, and more than 130,000 people have officially died globally. Singapore, one of the countries that has been singled out all along as having been most successful at keeping their coronavirus numbers relatively under control, saw a record jump in cases last night with 447 new confirmed cases. Officials are chalking up the bad numbers to the following, quoting the New York Times. Nearly half of Singapore's roughly 3,700 coronavirus cases are among low-wage migrant workers who have built the gleaming modern city-state. About 200,000 such workers, many from India and Bangladesh, have been quarantined to their dormitories, with healthy residents gradually being transferred to other housing to prevent community transmission. After weeks of slow transmission, Singapore began recording a rapid rise in cases in March as travelers from Europe and the United States brought the virus with them. But no imported cases have been recorded for nearly a week, end quote. Health officials, in fact, said that 404 of the 447 new cases came from those dormitories. Singapore has not seen any new imported cases over the past 5 days. Japan was another country that remained relatively open while thus far keeping corona numbers comparatively low, but numbers have been trending in the wrong direction lately. And just this morning, the Japanese government finally declared a nationwide state of emergency after previously announcing similar measures in Tokyo and 2 other urban areas. 17 new deaths were reported in Japan on Thursday, which until now had reported a comparatively low corona-related death number of 136. Meanwhile, is Haiti a surprising coronavirus success story? They're reopening textile factories next week. Quoting the Wall Street Journal, Prime Minister Joseph Juta's announcement could also signal some confidence in his own containment measures. As soon as the country's first 2 cases were reported in March, officials declared a state of emergency, closed off borders, and shut down churches, schools, and factories. Even with Haiti's high population density and a fragile health system, that swift action may have worked. Only 41 cases and 3 deaths have been reported so far, according to a Johns Hopkins University tracker, compared to a much more severe outbreak in the country's one land neighbor. The Dominican Republic, which has about as many residents, has reported more than 1,600 infections, including at least 180 fatalities, end quote. Should be noted, however, that only 500 Haitians have been officially tested, and that factories will be reopening at only 1/3 capacity to assist social distancing. More concern about meat processing plants. 150 coronavirus cases have been linked to a Tyson Foods pork processing plant in Columbus Junction, Iowa, and 2 workers have died. Quoting the Washington Post, the virus mainly spreads through person-to-person contact and is not considered a food safety risk, although some meatpacking executives have warned that outbreaks and shuttered facilities could affect the country's supply of pork and beef, end quote. Nearly 1/3 of the crew of a French aircraft carrier, or 668 sailors aboard the Charles de Gaulle and other ships in its battle group, have tested positive for coronavirus. Germany is moving to allow some small businesses to reopen next week, but Britain says it is too early to consider reopening anything at the moment, and Australia, which has been another one of those places which has so far successfully kept numbers under relative control, says that it will keep its lockdown in place for at least another month. Perhaps they have their eyes on nearby Singapore. And once again, questions around exercise in a time of pandemic. Yes, everyone is encouraged to keep active however possible, not only to help keep your overall health good, no point avoiding contracting coronavirus merely to have a heart attack, but at the same time, experts are warning that you can't exercise your way into avoiding the disease. In fact, overdoing it, exercising too much, might actually lower your immunity. Quoting the Washington Post, years of research into the relationship between hard and/or long efforts and their impact on immunity reveal that once you've crossed a certain line, you become more susceptible to illness. One of the seminal studies on the topic came from David Neiman, director of the Human Performance Laboratory at Appalachian State University. By following nearly 2,400 runners at the 1987 Los Angeles Marathon before and after the race, we were able to identify thresholds of exercise where your immunity begins to decrease, Neiman says. That study touched specifically on duration of exercise and found that, for the most part, up until about the 90-minute mark, immunity remains strong. After that point, however, it weakens. Runners in Neiman's study who completed the marathon, in effort much longer than 90 minutes, became sick in the week following the race at a rate of 5.9% higher than those who trained but did not complete the race. Although not 100% certain about why immunity decreases as duration increases, Neiman says that draining the body of its main energy source, glycogen, is probably to blame. Your brain registers the lack of glycogen, and then you get the negative immune response, he says. Another reason to prioritize moderate exercise, says Brad Stulberg, a California-based performance coach and author of The Passion Paradox, is that it will lessen the risk of injury at a time when physical therapists, massage therapists, and other practitioners are unavailable for hands-on visits. Neiman sees exercise along a risk-benefit continuum. It's important to find the sweet spot, he says about the pandemic. I recommend getting out every day and engaging in a moderate level of activity, but don't take it to a point where you are chronically tired. End quote. And, just putting this out there, but the WHO yesterday suggested redistricting the sale of alcohol. In a statement, WHO's Regional Office for Europe said that alcohol consumption, quote, compromises the body's immune system and increases the risk of adverse health outcomes. Therefore, people should minimize their alcohol consumption at any time, and particularly during the COVID-19 pandemic. The health organization also stressed that alcohol definitely does not protect from COVID-19, calling the claim that high-strength alcohol can kill the virus a dangerous myth, end quote. So, right now, the virus has us coming and going, I guess. Maybe there's something in the old saw of everything in moderation. Over the past several weeks, we've shared a lot of personal accounts from people who have had COVID-19 and discussed what symptoms to look out for in case you think you may have it. Now, as we get further into the pandemic, we're starting to hear from people who have had the virus and recovered. Fiona Lowenstein wrote an op-ed for the New York Times about how recovery from coronavirus is more complicated than headlines make it seem. Much like the realistic plans for reopening society, it's not a matter of going completely back to normal overnight. Lowenstein emphasizes how little was known about the virus's symptoms when she was first diagnosed in mid-March. She particularly faced some of the lesser-known symptoms at the time, including gastrointestinal issues and a loss of smell. And now, as she recovers, so little is known about recovery. Are people who have had it immune? Will they relapse? How long are they contagious? Will there be any long-lasting side effects? Feeling isolated in her recovery, and with so many questions, Lowenstein started an online support group for people who have recovered from coronavirus, which has now been joined by people from all over the world. In the group, they discuss their recoveries, which tend to be less than linear and often take far longer than the predicted 2 weeks. Lowenstein shared the experiences of some of the group's members. Quote, Sammy Avalos, an otherwise healthy 31-year-old in our support group, shared that on day 21 of symptoms, while her breathing had not felt strained enough to require medical attention, she was still coughing up blood, and her fever was breaking only to come back days later, like clockwork. Another member of our group, Charlie, 24, described his case as relatively mild, but said that more than 23 days into the illness, he's still experiencing a fever, cough, and shortness of breath. Sabrina Blake, 26, is grappling with severe fatigue and persistent breathing issues that make it difficult to walk, a month after she first felt symptoms. Jag Sang, 55, is still dealing with a persistent cough 4 weeks after his initial symptoms, end quote. Lowenstein herself has continued to face a myriad of symptoms in the 3 weeks since she was discharged from the hospital, including, quote, fatigue, intense headaches, continued congestion, a sore throat, trouble focusing, and short-term memory loss. She says she's, quote, still far from my normal active self. Because the WHO currently places mild cases at a 2-week recovery time and severe cases at 6 weeks, some people in the recovery group whose symptoms have progressed for longer than 2 weeks are having trouble getting additional time off work since they're officially recovered. And it doesn't help that the delineation between mild and severe isn't always clear. And Lowenstein brings up another challenge that she and others in the recovery group have been experiencing. Quote, Almost all are experiencing mental health problems, including severe anxiety, panic attacks, and depression, as they struggle to understand what's next for them. In addition to the physical symptoms that still keep me up at night, I have frequent nightmares in which I am once again gasping for breath." End quote. As for when someone can expect to stop being contagious, Lowenstein received discharge instructions that told her she needed to be retested to confirm she was no longer contagious. But she's been unable to get another test. Instead, the Department of Health told her to wait 7 days from the first day of symptoms and then to make sure the last 3 days were fever-free. But with fevers that come and go and reports of a patient in Singapore who still tested positive after 34 symptom-free days in confinement, Lowenstein has her doubts about the whole system. Finally, she says, quote, "Employers will need to reconsider expectations of COVID-19 survivors, and we can expect disability law to be tested. A wave of chronically ill and slow-healing survivors is an inevitability we can and must prepare ourselves for." End quote. There's been a lot in the news about hydroxychloroquine, the 65-year-old malaria pill aggressively promoted as a possible game changer by figures including President Donald Trump as a possible remedy for COVID-19. Numerous studies are underway, and some early research, so new it has not yet been peer-reviewed, suggests it doesn't help patients clear coronavirus from their systems, but may have anti-inflammatory action that helps with some of the symptoms of the disease. Quoting from Bloomberg, "The pill didn't help patients clear the virus better than standard care and was much more likely to cause side effects, according to a study of 150 hospitalized patients by doctors at 16 centers in China. The drug did help alleviate some clinical symptoms of COVID-19, however, and the patients who took it showed a greater drop in C-reactive protein, a measure of inflammation. When testing new treatments, we are looking for signals that show that they might be effective before proceeding to larger studies," said Alan Chang, an infectious diseases physician and a professor of epidemiology at Melbourne's Monash University. "This study doesn't show any signal, so it's probably unlikely that it will be of clinical benefit." There were more side effects in the group of 75 people who took hydroxychloroquine, but they were mostly mild, the most common being diarrhea. The researchers, led by Wei Tang of Rujin Hospital in Shanghai, wrote that the medicine's anti-inflammatory effects probably helped alleviate patients' symptoms. End quote. Another study, this time in France, found no significant difference between a group of patients taking the pill and a group that didn't. Quoting from the South China Morning Post, "A French team led by Mathieu Mehevas of the University of Paris-Est decided to investigate what happened in a real-world setting. They pulled the medical records from 4 hospitals in France of 181 patients of similar gender, age, and health conditions. All the patients required oxygen because of lung infections caused by the virus. The researchers said these patients were more representative of those admitted to hospitals swamped by the pandemic than those in some previous studies. Among the patients who took hydroxychloroquine upon admission, 20.5% had entered the intensive care unit or had died within a week. Among the patients who did not take the drug, the rate of ICU admission or mortality within a week was 22.1%. The researchers said statistically, there was no difference between the two groups. In conclusion, we found that hydroxychloroquine did not significantly reduce admission to ICU or death at day 7 after hospital admission, or acute respiratory distress syndrome in hospitalized patients with hypoxemic pneumonia due to COVID-19, the authors said. End quote. Research continues into the chloroquine family of drugs as doctors search for any weapon in the fight against coronavirus, and we'll bring you updates as these studies publish. Some good news on the testing front. Abbott Labs has announced a new antibody test that it'll start shipping this week. In a statement, the company said, "Antibody testing is an important next step to tell if someone has been previously infected. It will provide more understanding of the virus, including how long antibodies stay in the body and if they provide immunity. This type of knowledge could help support the development of treatments and vaccines." End quote. Abbott will ship 1 million tests this week, ramping up to 4 million by the end of April. The company says it'll be able to produce 20 million tests by June. Quoting from Business Insider, "Experts say antibody tests are key for letting people out of their homes again, returning quarantined health workers to the front lines, and measuring large swaths of the population for potential immunity. The tests could help government officials figure out when it makes sense to ease lockdowns. Abbott's test will look for the IgG antibody, a protein produced in the body's secondary immune response. It lasts for months and possibly years after a person's been exposed, according to the company. Additional testing that identifies the IgM antibody, which is produced immediately after exposure, is underway, Abbott said in a statement. End quote.
It seems like there's more anxiety in the world now than ever, and a lot of us can get hooked watching the news, nervously refreshing our feeds every 5 seconds to try to feel more in control. That's kind of why we started this podcast, to give you the news in tiny, digestible bits so that you can go on with your life. But getting personalized support for your well-being is also a top priority for getting on with your life. That's why Talkspace pairs you with a licensed therapist based on your preferences. Talkspace has thousands of therapists in over 40 specialties like anxiety, depression, relationships, and more. Security, safety, and privacy are also top priorities at Talkspace. Their platform encrypts and securely stores all client information. We all need to talk through life's challenges in a safe space. Talkspace is that safe space, offering the support we deserve at a price we can afford. Match with your perfect therapist right now and get $100 off your first month with promo code BRIEFING. Sign up right now at Talkspace.com or download the Talkspace app. Don't forget to use promo code BRIEFING for $100 off your first month with Talkspace. Use the internet with confidence from your computer, tablet, or smartphone with ExpressVPN. ExpressVPN has you covered on every device. Simply tap one button and you're protected. ExpressVPN encrypts 100% of your data with best-in-class encryption, so your information is always protected. Each ExpressVPN server has an IP address that's shared among thousands of users. That means everything you do is anonymized and can't be traced back to you. Even in incognito mode, your online activity can still be traced. Even if you clear your browsing history, your internet service provider can still see every single website you've ever visited. That's why even when I'm at home, I never go online without using ExpressVPN. ExpressVPN makes sure your internet service provider can't see what sites you visit. Being stuck at home these days probably means you haven't been thinking that much about internet privacy on your own home network, but actually this is the perfect time to sign up for that virtual private network you know you've needed to set up to protect yourself. There's never been a better time to protect your online activity today with the VPN that I trust to secure my privacy. Visit my special link at expressvpn.com/report, and you can get an extra 3 months free with a 1-year package. That's expressvpn.com/report. expressvpn.com/report to learn more.
Mass-scale rapid testing might help us get back to some semblance of normal life, but it won't stop the virus from being contagious. And until we have a vaccine, the question of just how contagious COVID-19 is remains a pressing matter. Stat spoke to scientists to get a better understanding of how the amount someone is exposed to the virus may lead to worse symptoms. As we all know by now, COVID-19 is spread by virus particles being expelled by an infected person, typically via a cough or a sneeze. How much of that virus has to be present in order to infect someone is referred to as the infectious dose. The lower the infectious dose, aka the less of the virus has to be present to cause infection, the more contagious the virus. Scientists therefore believe the infectious dose of SARS-CoV-2, the virus that causes COVID-19, to be very low. There's also the viral load, which is, quoting Stat, the amount of virus present once a person has been infected and the virus has had time to replicate in their cells. With most viruses, higher viral loads are associated with worse outcomes, end quote. Dan Baruch, director of the Center for Virology and Vaccine Research at Beth Israel Deaconess Medical Center, told Stat, "It's not proven, but it would make sense that higher inoculating doses will lead to higher viral loads, and higher viral loads would translate into more pathogenic clinical courses," end quote. Stat also notes that people with higher viral loads may be more contagious due to the probability of them shedding whole viruses, and that frequent low doses could have the same effect as one high dose. All of this adds up with the severity of symptoms we've seen around the world in healthcare workers who have high exposure to infected people, especially those healthcare workers who lack sufficient personal protective equipment. In Italy, about 9% of reported cases were healthcare workers, and in California, they represented 10% of reported cases. So apart from this being a strong reason why we need to make sure healthcare workers have access to proper protection, as if further reasons were needed, this also lends credence to the efficacy of wearing a mask while out in public. Let's end today with more on Singapore's situation, since it led the news at the top of the show. Singapore's recent imposition of a lockdown to combat a third wave of COVID-19 infections is drawing increasing attention here in the U.S. as pressure mounts to reopen parts of the economy as early as May. Quoting from the New York Times, Singapore officials have been screening and quarantining all travelers from outside the country since the beginning of the pandemic. Their contact tracing is second to none. Every time they identify an infection, they commit to determining its origin in 2 hours. They post online where identified infected people work, live, and have spent time so that potential contacts can be identified. They enforce quarantines and isolation of such contacts with criminal charges for those who violate orders. And yet, in the last week, they've put the entire country into lockdown. All migrant workers are confined to their compounds for at least 2 weeks. Citizens may leave their homes, but only to buy food or medicine or to exercise. Anyone who breaks the rules, including spending time with anyone not in their household, can be imprisoned, fined the equivalent of $7,000 or both. What Singapore was doing dwarfs what most are discussing in the United States, and its present circumstances bode poorly for our ability to remain open for a long time. There's just no way that we're going to be able to keep most of the country open through the year, said Ezekiel Emanuel, Vice Provost of Global Initiatives at the University of Pennsylvania. If Singapore can't do it, I don't imagine how we think we can. As I have said, this is going to be a roller coaster with multiple waves of opening and partial reclosings necessary. End quote. Again, Singapore's bad news yesterday came from these migrant communities that were put into lockdown. Perhaps what we're seeing today in Singapore is a case of what we've been talking about, having the ability to quickly detect new flare-ups and hotspots as they develop. It's too early to know if this is a new hotspot that authorities can quickly contain. What would be required to have something similar occur in the U.S.? Paul Romer, a Nobel Prize-winning economist and NYU professor, told The Times that we should aim to test 7% of the population every week, essentially ensuring everyone in the country was tested every 2 weeks. Anyone with a positive test would be isolated, but the vast majority of Americans would be able to go about living something approaching normal life. That may sound like a huge undertaking, but Romer is keen to set it in a broader context. We spend something like $700 billion a year to protect us against military threats, he told the paper. We are at greater risk from a biological threat at the moment than any military threat. We should be prepared to spend at least $100 billion a year, not only to protect us against this virus, but any potential new viruses that could threaten us in the future. Greg Gonsalves, a professor of epidemiology and law at Yale, told The Times, social distancing is happening in only a patchwork across the United States. The next phase needs a massive national mobilization not seen since World War II, with dramatic scale-up of the production of tests for the virus and its antibodies, the commodities we need to do these tests, from long-stemmed swabs to RNA extraction kits, and the personal protective equipment to keep those conducting the tests safe. We also need a new cadre of people to do these tests, trained and deployed across the country, and that's the first step. End quote. Another option? Mass contact tracing enabled by smartphone apps. As we covered on Monday, Apple and Google are teaming up to develop a coronavirus contact tracing system. The system will keep track of which phones have been in close proximity to each other. Official apps from public health authorities will be able to access this data. Users who download these apps will be able to use them to report a COVID-19 diagnosis, and those same apps will then alert other users if they've been in close contact with a diagnosed person, theoretically providing an instant contact tracing mechanism. It's likely a mix of these measures will be needed to open society and keep it open, and it will be expensive, but probably less expensive than another lockdown. That is all for today. As always, this show was produced by Ride Home Media. This episode was written by Brian McCullough, James Welsh, and myself. Until tomorrow, be well.